Artificial intelligence, or AI technology, is being applied in many fields, including medicine. But how comfortable would you be if your doctor consulted a computer about your health care? Dr. Nidhi Kumar is on call this morning with more on how AI may change medicine. Good morning to
Hi,
you.
good morning.
Thanks so much for being here. So most people have heard about AI programs like ChatGPT, but how is it being used in medicine?
Well, so artificial intelligence is the simulation of human intelligence by machines, and it is touching nearly every area of medicine at this point. And medicine is in this unique position to really develop this type of technology, because to build artificial intelligence algorithms, you need massive amounts of information and data. And we have that in medicine. That data is then put into these computer systems, and then these systems learn pattern recognition. They learn how to analyze images, and then finally they learn actual autonomous decision making.
Wow, where is it being used right now?
So it is being used in the diagnosis of cancer. There is an algorithm called Lena that actually will analyze lymph node tissue from patients with breast cancer to look for abnormal cells. It has a 99% accuracy rate, and it can actually identify cells that the human eye cannot. It's been used in all areas of radiology, looking at chest x-rays, CAT scans, MRIs. There's actually a really interesting program called Sybil. She was developed by she was developed by researchers from MIT and Mass General, and it's a lung cancer prognosticator. So it can predict if a patient is going to have lung cancer in the future by looking at CT scans. 86 to 94% accuracy rate.
Wow.
It's used in mental health. It's used to train mental health counselors. It's used, AI-powered chatbots are used to support people dealing with substance abuse issues. And my favorite are the companion robots. So there's a really interesting little robot. It's a robotic dog named Paro, developed in Japan, has been widely used and studied in patients with Alzheimer's and autism. It reduces anxiety, stress, and increases socialization in these patients. So it's here.
Well, one of the things people are concerned about is whether personal medical data could be compromised as a result.
There are definitely security and privacy issues, and this is a big concern. But to ensure safety, it's really going to take some global consensus. You know, governments all over the world are going to need to come together and figure out what regulations need to be in place, because it's technology, so it doesn't have physical borders. Other concerns are about liability. You know, if the machine makes a mistake, well, who's to blame? Right now, particularly in medicine, there's human oversight. In the future, will there be? There are the concerns about AI eliminating jobs. And then there's the concern of AI having built-in biases. Because when we feed these computers data, unfortunately, a lot of the data in our medical system doesn't necessarily reflect the diversity in this country. So there could be a mismatch with the way the program was developed and the population for which it's being deployed.
And it really looks like this could just keep on expanding exponentially.
Oh, absolutely.
All right.
Absolutely.
Well, we'll be watching. Dr. Nidhi Kumar, we know we'll be focusing on this and asking you all of the questions. So thank you so much. Great advice, too, for us.